Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program here on Power 96.5 WUFO FM and 1080 AM WUFO. My name is Francesca Messiah from Kaleida Health, and I am the manager of community health improvement. And what does that mean? You know what that means? That means that we are Kaleida Health. We are closely aligning ourselves with the Erie County um, Department of Health Community Health Improvement Plan. So this means that we are all on the same page when it comes to your health, your wellness, your behavioral health, your housing health, your health in general. It dawned upon me. I said, let me just give say a few words about what is the Community Health Improvement Plan. And I'll have more of that next time because I'll share in segments throughout the year. Well, we have a really exciting topic today with ladies from our Galisano Children's Hospital. You may say, Galisano Children's Hospital? Francesca, that's too many new things you're telling me. Galisano Children's Hospital. Let's say 10 years ago, it was Children's Hospital of Buffalo. And then it was Oshai Children's Hospital of Buffalo. But now we have a new name from a generous member of our community, and now it's now called Galisano Children's Hospital. From Children's Hospital, Oshai Children's Hospital, Galisano Children's Hospital, I just want to say and reassure you, we are providing the same excellent quality services for our community, for your children, your grandchildren, your stepchildren, your foster children, your neighbors' children. So I just want to make sure that you know, and you've seen the name. If you've seen the name Galisano Children's Hospital, it's not a new hospital. It's the same hospital, same quality services, but Tom Galisano has been a generous donor to our Kaleida Health System, and now it's called Galisano Hospital. So I just wanted to mention that. And our guests for today are two fascinating women I met last week at a wellness program we had at Kaleida. I've been with Kaleida 21 years, listeners. Thought I knew everything. I don't know why I did. But did you know that at Kaleida, we have what's that called our Artist in Residence program, Artist in Residence Healing Arts Program. And when I looked over in this room a few weeks ago, and I saw people drawing and doing all kinds of creative things with markers and crayons. There may have been even paint. I had to focus on what I was doing because really honestly, I was looking at what was going on in the corner. It looked like it looked like one of our local art galleries. So I want to introduce to you our two guests for today, Carly Todoro Rickus, who is an artist in residence healing arts program. Good morning, Carly. How are you?
Good morning, Francesca. I'm doing great.
Oh, good. And then Danielle, was it Danielle Siva?
Siva, yes.
Siva, Artist in Residence Healing Arts Program. Ladies, I want to say welcome to your first time on the Great Lakes Health Radio program. And I believe this is part one of part two. We already know that. We've already discussed that. So this is part one of the Healing Arts Program, which comes under the heading of, or the Department of Family Support Services for our children and their families at Galisano Children's Hospital. So on that note, could you briefly describe the Galisano Children's Hospital Family Support Center and also talk a little bit about Healing Arts Program?
Yes, Francesca, thank you. So what's good to know about the Healing Arts Program is that is where we're housed. The Family Support Services at Galisano Children's Hospital is a really large department, and we are there to support families, as the title says. You can find under Family Support Services the child life department and child life specialists, social workers who are helping families. The volunteer program is run in the family support services. We have a family advisory council made up of parents who are really passionate about the care their kids got here and how they can help others have that same care. We have a spiritual care department. We have a Stones Buddies organization, which is also a great organization for families of our kids who we are sort of medically complex or frequently involved in the hospital programming, and they do fun things outside of the hospital with Stones Buddies. And we also have our patient relations specialist, Stephanie Fernandez. We're all part of how can we help our patients and families in the hospital have their best support and experience. And after all of that, Healing Arts and the Artist in Residence program is a part of that. So it's how can we help our patients and their families have the best experience they can have in the hospital, which typically I like to say, unless you're just coming in to have a birth that's, typical and there's no complications. Most people that are in the hospital are here for not a great reason for them. It's stressful, they're medically complex, or they've had an accident, injury, or illness. And through the arts, we're here to help you have a better experience.
Is the Healing Arts program at most children's hospitals across the country, or is it unique to the Golisano Children's Hospital?
So most hospitals in general, including children's hospitals, a lot of cancer-based centers, and hospitals across the country will have some sort of an art program. Some of the programs fall through the child life department. Like I'd said earlier, we're housed with child life under family support services, but it is something that you should be seeing at most large size hospitals, the children's hospitals, cancer centers. Some other hospitals might have some programming as well too, but it's something that has really been there for a long time. There's a large history of arts and healthcare and ways that artists, musicians, writers, dancers, it really encompasses all the arts in ways we can help patients who are here in the hospital.
So how did you and Danielle become involved with this department?
So I am the longest running artist here at Golisano Children's. When you'd mentioned earlier about the name change, we started back when we were Women in Children's Hospital of Buffalo over on Bryant Street. And it was the year 2008. And we were started actually by a grant that the University of Buffalo had secured because Catherine Trepanowski, who is still involved in the University of Buffalo Center for the Arts, and Tom Burrows, who at the time was the director, had been going to national conferences in arts and health. And they were learning about what other hospitals and communities had. And they said, we want that for Buffalo. They said, this is wonderful to have artists and musicians and writers embedded as part of the hospital staff and working towards wellness for the hospital community, which does include staff too, I should add, as part of our community who we're benefiting. And they secured a grant and they looked for artists who would have the right fit to be someone who could practice their art and also engage and facilitate art in the healthcare setting, which isn't for everyone. It's a very different way to work than in schools or in communities. But that's how it got started. So I was part of like the second year cohort of artists, and they had approached me. I'd gotten my arts degrees from the University of Buffalo, and I worked there, and they knew me well, and they said, we're starting this arts and healthcare program. I think you'd be a really wonderful fit. And the first year I said no, only because I was traveling out of town a lot and working in performance and on tours, and I wasn't able to commit. And the second year I did. I said, I'd really like to be part of this program.
Yeah, and I'm the newest artist in residence at the hospital, and I have been teaching art. I'm also an artist in the community. I'm a muralist and a painter, but I've been teaching arts for healing for quite a few years now. I've worked in prisons, I've worked in rehab facilities, I've worked with special education, and I worked at Locust Street Art, which is around the corner from the hospital, which is how.
Maui Olga.
Yes, Molly Olga, you know. Very near and dear to my heart. And somewhere along the line, because we're in the same community, we're right around the corner from each other. Carly and I connected, and that's how I found my way here.
That is wonderful. And I just have to ask, muralists, are you responsible? Are you and a team responsible for some of these beautiful murals that over the past few years have popped up throughout Buffalo?
Yes, I am. I do my own on my own time. I have like my own practice, but I also work for the AKG Museum and their mural team. So a lot of the murals you see go up with AKG, I'm on their team. I'm on the ground and in the
Yeah.
list.
Okay, and I know we just went off track, but AKG, for those of you who have been in Buffalo all your life, is the Albright Knox Art Gallery. They just changed the name to AK, to the initials, a couple of years ago. So when you talk about working with children, is it just children, or is it children who are inpatients, outpatients, or both? And are the parents involved?
Yeah, so we engage the entire hospital, whether that be infusion patients who are just there for the morning or the afternoon, to our oncology, hematology patients who are here more long term. When we go into a room, it's we're there to engage the patient, but we're also there to engage parents. We're there to engage brothers and sisters, sometimes grandparents, sometimes cousins. We also do pretty extensive work with parents. We work with on our seventh floor, we have antepartum moms we work with pretty extensively. We also do programming in our NICU,
You have what kind of moms? I missed that.
antepartum moms.
What's
Um,
that?
so, so moms who are either going to be giving birth, but they're having a complication, and they need to be um, housed at the hospital until they do give birth. Sometimes that can mean a couple weeks. Sometimes that could mean a couple months. So we really try to engage with them to give them something to do during their stay. And then we work with a lot of NICU parents as well. So parents who have a newborn in our ICU, we do every single Monday, we try to get them together alongside with our antepartum moms and try to engage them as well.
Okay. Well, we know the babies and Nick you can't paint. So like what do you do with the parents then?
So we do something called creative connections. So I usually go down every Monday, set up some tables in the NICU. They have something called a solarium, so just a little meeting area, and we'll do art for healing or art for relaxation. So I usually bring a little project around the floor to see if any parents are not busy and would like to come join us, and it gives them really a space to talk about the experience of being in the NICU. I think it's a really uh, that's really an experience you really don't understand unless you are a parent who is experiencing that. So it gives them a way to connect and also some downtime to get away from the room and to relax a little bit and to find connection with one another.
And Carly, what in case someone doesn't know, what is a NICU?
So the NICU is our neonatal intensive care unit, and it's for babies that, since Danielle and I are not clinicians, I don't know if I can say it in clinical terms, but they're babies that need a certain level of support that's given to them after they're first born. And we do have some NICU babies who will have medical complexities and needs so great that they will stay in our NICU for like weeks or months before they could be discharged home. And even there's some kids who become old enough that they're moved up into like one of our floors in the hospital if they're just not ready to be able to be healthy enough to be discharged.
Hmm. I just thought about something. Do you ever have parents doing any artwork around like, especially a NICU baby, like around the footprint or the handprint of their child?
Oh yes, all the time.
Oh, do you? Oh, I thought I had
Yes,
something new for you.
yeah. They keep little ink pads in the room, and so we do
Yeah.
little projects at our Creative Connections, and then all they have to do is kind of glue in that footprint into the art project. We use that all the time.
Yeah, and one of the things that I can say too is that part of us, and I think I'd mentioned that Danielle and I are non-clinicians, what's really special about being a visual artist in residence who's had like all the training of being part of the hospital staff, but isn't necessarily a clinician, is that we also partner with a bunch of clinicians in the hospital. So, for example, about like the NICU project, when the babies are having their footprints done, the nurses in the rooms really love to be a part of that. We have a child life specialist, Brianne Smith, who is down there, and she likes to be a part of that too. So sometimes what we're doing is we're creating an art project or a finished piece that they're doing with the prints that were gotten by a nurse or by our child life specialist. We all kind of work together to give the parents, whatever it is they need, which might be, if it's like psychological support, it's coming from child life and social work and psychologists down there. And then we're helping them like relax and maybe, do something fun for their baby, like a footprint project. Or we do a lot with name signs too, like designing a name sign for your baby.
A name sign. Oh, for because the child is in like intensive care or something, right?
Yeah, so like people like to have like their own designed name signs for the baby that can be laminated and then and put up by their isolette in their room.
Yeah, and you can take it home with you too, right?
Yeah.
Yes, yeah,
It could
and
be
we do
the
a lot of projects like that. Yeah.
it could become the baby's nickname. You never know.
You never know. We do a lot of like acrylic on canvas, especially like for some of our parents who are antepartum before they give birth. A lot of those moms that Danielle mentioned earlier too, who are like waiting to give birth in the hospital and maybe didn't expect that they were going to now be hospitalized for weeks or months before their baby's born. We sometimes help them finish decorating what they're going to make for their nursery.
Mhm.
And sometimes they're working on paintings to hang so that they have that stuff completed.
hmm Now you mentioned moms. Is it just moms at this point you're working with, or is it sometimes dads as
Oh
well?
yeah, we do moms, dads, grandma, grandpa, siblings sometimes. Yeah, we engage everybody. I've worked with plenty of moms and dads.
Oh, okay, all right. Just want to make sure, I didn't want to leave the dads out.
Of course not.
Now, does a child have to be verbal in order to participate with the Healing Arts program?
No, absolutely not. It really is whenever we go into a room, it really does not matter what's going on with the child. We work a lot with the staff, with nurses, with PT, to kind of get an understanding of what's happening with the child in order for us to create an art project that is catered towards them and their needs. So yeah, absolutely not. They do not have to be verbal. I think we try to work through any sort of barrier that could prevent us from communicating. Because visual art really, I think that's what's really special about what we do is it doesn't necessarily have to be talking. It's really about working with our hands, and that can look different case by case.
I was going to add too, and also language barriers go away when you're doing visual art. We do have interpreters in the hospital so that we're able to communicate with our our population that isn't speaking English as their first language. But sort of once we establish who we are and why we're there, you can sit and you can listen to music, you can paint together, you can kind of communicate visually rather than verbally too.
You've talked about painting, and I observed drawing. Besides painting and drawing, what are some of the things? And you talked about working with your hands, so that's what made me think of this question. Do you work with clay at all, or is it just painting and drawing that you normally
Oh,
do?
yes. So we have air dry clay here. We do beadwork, so bracelets and necklaces.
Oh yeah.
We have something called model magic, which is a little bit of a cleaner type of clay for like the little ones. We have crafts. We have, I'm looking around the room. What else do we have? We do felt projects a lot. We do weaving projects. Some of the women like to crochet, especially the women on the seventh floor. So we can bring them crochet needles and yarn. Really, when we go to a room, it's more of I try to kind of figure out who the child or the person is, what they enjoy, and then I'll grab materials or a project based on how I get to know the certain individual. But we have to get creative a lot too of what each individual may need or want and how to engage them the best that we can.
Hmm. Now, in the church, we use the term testimony. So, what are some of your testimonies, some of the things that you've observed from working with the children or the parents, through the Healing Arts program?
I was just told the other day, I was pulled aside by a parent who was like, this was in the NICU. They'd been here for quite a few weeks now. And she pulled me aside and really said, like, you have no idea how much I needed this. I think that's something we hear a lot is like, you don't know how much we needed this. But I know, do you have one too, Carly, that comes to mind immediately?
Yeah, I would say there's two levels of this. So one is when we work with some of our infusion patients, they may come in just once a month for the afternoon, but some of them look forward to doing art when they're here so much that the parents say that they're actually looking forward to coming to the hospital. They like to come in because they like to see the artists in residence and work on their art, which is a testimony because we
It
want
is.
kids to feel comfortable and safe and want to be here. And then, in the other extreme is kind of like Danielle, like talking about an adult patient. We had an antepartum mom who was here for months who literally said, it was life-saving for her to be able to have the time with us. And we haven't really talked about what the art does. And it becomes relaxation. It can be relaxation and distraction. It helps people pass time. When you get involved in making art as an artist, sometimes you lose hours because you're so involved in what you're doing. And when you're living in a hospital room and there's only, four walls and so much within it, there are a lot of people that are there to help you get through the day. You have child life therapists who are coming. You have, social workers who might help you alleviate stress outside the hospital. You have, nurses who are doing their best to make the day brighter and everything go easier. But with the art, it's almost what we call it's the flow state of creativity that psychologist Csikszentmihalyi had developed a long time ago. And it's the idea of if you get involved in a project and you start just thinking about what am I doing next in my art, time ceases to exist and all you're thinking about is your project, and that will help pass the time away. It'll help you get some mental break from all the stress that you have with your illness in and outside of the hospital. But it also leads to lower blood pressure. I had nurses say, "Oh, Carly, I wish you could stay all day because they're doing the vitals and they're like, this blood pressure is so great right now." And it's because they're working on their art and they're not stressed out.
That is, and I was just thinking, and I'm sure it also helps the child to see that happy parent, caring adult smiling. If you're in the hospital, like you said, you're not going to a party. You are there for a reason, for some kind of an illness. And to see that adult smiling and laughing, it has to be contagious and also impact the child versus if you're frowning and not smiling. I would just think that would be another area that would make that for the whole environment just a better place to be.
And I think what's really important to mention too is that we're one of the only non-clinicians that come into the room. So we're not here for one, you can say no. I think that's a huge part about our program is anybody else who comes into your room, you can't really say no, but you have the ability as a patient to say no to us. We ask you and you can say no and we can leave. But we're not clinicians. We're just folks who are from the art community, who love what we do very deeply, engaging the kids here. So we're bringing what we love to the hospital and the patients here. And so I think that's something that's really unique about us. That's a little bit different than any other program. So we're not clinicians, but we're here to bring what we love to the folks here.
Passionate. That's the word. Passionate.
Very passionate.
Passionate. And you're right. There is a feedback circle because, like you had said, if the child sees their parent is relaxed and happy, and it also works in the opposite direction. So sometimes when we're working with a pediatric patient, we'll ask the parent, while we're making art with your child, would you like to participate? Number one, because sometimes it's a connector. It gives the parent and child something to do together that we're leading and curating to be non-stressful and something they can bond over. Sometimes it can be that the parent is like, oh my gosh, like I see they're engaged with you. Can I take a shower? Can I go make a phone call? Can I get a coffee?
Yeah,
And their child, like when they're comfortable with us, that might be a time the parents like feels okay enough to like leave the room for a second to do something they need to do. And sometimes I've had parents where I've asked, would you like to participate? And they've said, oh no, I actually find it really relaxing just sitting here watching you with them and watching them relax and hearing your voice and having it be, like you said, putting a smile on their face is making the parent happy. So it definitely works in all of those directions.
Yeah. Yes. And Carly and Danielle, I know we only have a couple minutes left, literally. What can we expect to hear in part 2? Because there's going to be a part 2 of part of the Family Support Healing Arts Program. So what can our listeners expect to hear?
So in part 2, there are 3 of us artists in residence who work here for Golisano Children's of Buffalo. Danielle and myself, who you've met, we're both visual artists, and like drawing and painting and sculpting is our expertise. The third artist in residence, Monica Carwan, you'll meet in part 2. Monica comes to us and she practices music, movement, mindfulness, and creative play with our patients and families here in the hospital. So Monica will be telling you all about what the work that she does, as well as we're inviting in Kristen Williams. Kristen is the supervisor of Family Support Services. Mackenzie Mattinson is our director. Kristen is the supervisor. Kristen supervises our arts programming, and she is the head of the Healing Arts Program, Art on the Walls. So really the traditional healing art program is we have an art collection. We have an art collection in the hospital of professional artists that's been curated by an art committee from the hospital from the time we moved from the old hospital into our new building here on High Street. And Kristen and Scott Propriak, who is the director of the Birchfield Penny Art Center. Scott has donated his time for years to be the head curator of our art collection. Cynthia Simonelli is also someone who spent a lot of time and effort into getting us art. And Kristen and Monica will be here to talk to you about Art on the Walls and Monica's contribution as the third artist in residence at the hospital.
Wonderful. And on that note, Carly and Danielle, I hope that you'll be part of that program. And I look forward to scheduling part 2, because I think this is just so important for the community to know. Not only do hospitals have NICUs and ICUs and physical therapy, and we have fun, we have healing through art, healing through the soul. And I look so forward to being with your colleagues on part 2. And I might even ask them to sing, have a sampling. So on that note, I want to thank both of you, Carly and Danielle, for being our guests this morning on the Great Lakes Health Radio program. Topic: Healing Art Program. I am your host, Francesca Messiah, Manager of Community Health Improvement. Don't go anywhere. We'll be right back. And now on to part 2. And welcome to the second half of the Great Lakes Health Radio program. I'm your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. And I just want to thank you for staying on since the first, listening and not changing that dial. Or if you're just joining us, welcome. And again, I appreciate listeners. I appreciate you listening. I appreciate when I see you in the community asking, letting me know you've, heard a show. But I also want to say to you, listeners, when I see you, if there's a show that you would either like repeated or a topic we haven't covered, please let me know. Kaleida Health, we have over 13,000 employees, and I know we can cover the topic you're interested in hearing. All right. Well, moving on. So the second part of our program, we'll be speaking with Nicole Caver, who is a regional perinatal data specialist. Good morning, Nicole. How are you?
Hi, good morning. I'm good. Thank you.
Oh, thank you for getting up early this morning to join us. And our topic for today is the regional perinatal data specialists they are part of Oshai Children's Hospital. I don't think I mentioned that before, but they're part of Oshai Children's Hospital. And so, Nicole, we are just going to get right into the topic. And you are a data specialist. How did you get into this field?
So I got into this field, specifically public health, after I graduated with my undergrad degree in biology. I think my senior year, I took a class in epidemiology and I really fell in love with the field. So then I went on to pursue my master's in public health from George Washington University. And ever since then, I've been really interested and kind of enamored in data analytics and data science. And also, while pursuing my graduate degree, I also really felt compelled to focus on maternal and child health, considering the complex issues that our state and the country faces when it comes to maternal and child health.
That's true. That's so very true. Um, so what is the Regional Perinatal Center, and how long has a perinatal data center been around and been collecting data?
Sure. So the Regional Perinatal Center, or the RPC, is a designation given by the state in its effort to regionalize perinatal healthcare across the state. And basically, it provides the highest level of care to birthing people and offers a level 4 NICU. And basically, that means that we are able to provide highly specialized care to some of the most sickest neonates or infants, and also some mothers or birthing parents with very complex pregnancy issues or complications after pregnancy.
Mm-hmm. So does that mean that that's where if someone had a premature baby, that's where they would probably you would probably be collecting data
Yes.
on the baby?
Yeah, so we would hope that all of our affiliate hospitals, if there is a birthing parent in the community who gives birth at one of our affiliate hospitals, and our affiliate hospitals are distributed across all the 8 counties in Western New York, except for 2, because they are now maternity deserts due to their delivery services closing. But if a baby who was less than 35 weeks or 32 weeks were born in the community, we would hope that they would come to our hospital, considering we can take care of neonates as young as 23 weeks and above.
Okay. What was the number you said? 35 weeks?
Yes. So we normally say that 35 weeks and above is generally, quote unquote, low risk. And those would be the pregnancies or deliveries that our level 1s would be most comfortable handling. And they do an exceptional job of making sure that those babies are safe. But sometimes when complications arrive, or if they are less than 35 weeks, then they'll have to be taken to a hospital with a higher level of care. And that's kind of where perinatal regionalization comes in. We want to make sure that people can go to the places that they need to go and have the services tended to them that are best suited for their needs.
And now you say 35 weeks. How many months is like 30? Around how many months are we speaking of?
I believe that's close to 7.5, close to,
Okay.
yeah, around that. Because 40 weeks is term. Anything 37 and above is considered term. And then 35 would be like late preterm.
Okay. So besides collecting the data, do you collaborate? Because I believe there was a program that your department, Regional Perinatal Center, collaborated with Buffalo Pre and Perinatal Services, right? Wasn't there a program a couple of months ago?
Yes, we held our annual conference, the Perinatal Updates Conference, if that's what you're talking about,
Yes, the
and
perinatal. What was it?
the Perinatal Updates Conference.
Yes, yes, yes. And what was that about?
So it was basically an event to try to engage our community members, and as well as our hospital members, people who work in clinical settings, to discuss current best practices for maternal and neonatal care, and also find ways that we can better support each other in these organizations and making sure that our patients are satisfied, making sure that our staff feels comfortable and up to date in what they're doing, and to know that as the RPC, we are trying to support all efforts to advance and improve care within the Western New York region.
And RPC is Regional
Perinatal Center.
Okay, okay. I just want to make sure that our listeners understood. So, what were some of the outcomes? What were some of the lessons learned, or things who people might have been charged with as a result of the conference?
Yeah, so one of our speakers was Dr. Robert Haas. He is a physician out in Olean General Hospital, and he works at a level 1 hospital. And he shared a couple of examples of how, we may just be a level 1 hospital, but we are mighty in the care that we provide to our patients. And he described to us some out of the box ways that he was able to increase medication adherence for an Amish family who they experienced some difficulties during their pregnancy, and making sure that they abided by their medication regimen was a way that the baby was healthy and that the birthing parent was healthy as well. We heard from Dr. Michelle Loria. She talked about some of the life or the like later in life complications of pregnancy complications and how they can manifest later in life. And we also heard from people who talked about ways that we can better support mothers dealing with substance use disorder, and how we can reframe our language so that we can provide more compassionate care. And also from Sally Dreslin, who works a lot in rural health, and she provided us with some maternal rural health statistics that I feel like we're a little bit of a missing link to our region. I feel like people underestimate how rural our region is. And when you get outside of Buffalo, the populations are pretty small and pretty spread out. And rural health is of great importance when we're talking about the Western New York region.
Yes, and rural health is also one of those national topics you hear as well, because they don't have the same facilities. But thank you for that for the update. So, what's the process of once the data is collected, how decisions are formed?
Sure. So we take the information that the data provides to us, and we also look at what are, like I said, current best practices. And those usually come from agencies or organizations like the American College of obstetrician gynecologists. We take advice from the from AAP, American Association of Pediatrics, to help inform the care that we provide. So some of the outcomes that have come from that, and also some of the decisions that are made, are also due to state projects that they have going on. For example, the Birth Equity Project that has now transitioned into the Birth Equity and NTSV project, which stands for nulliparous term singleton vertex. And in theory, these patients who present with those features should have an uncomplicated vaginal delivery. And when we see high rates of NTSV, sometimes it can be unclear. And
Acronym, what does that mean?
Nulliparous term singleton and vertex.
Okay,
Those
thank
are
you.
all descriptors of how the baby is presenting when it's ready to be delivered. And it's a combination of things that can indicate that the delivery, like in theory, should be low risk, but we know that isn't always the case. And looking at the number of, looking at the rate of those deliveries kind of points out, well, are we doing the best thing all the time? Like, were these types of deliveries indicated? And looking at the rate can kind of tell us, well, is there any way that we can bring this down? Because if in theory they were able to have a vaginal delivery, well, why didn't they? And if it was a true medically indicated reason, is that something that we can work towards?
That sounds complicated.
It is, and there's a lot more to it. I personally, I know that they are ongoing with this initiative and that it's pretty new, but it's a hot topic in our communities. And yeah, it's something that a lot of people are looking into. It's not like a definitive like cause of bad outcomes or anything like that. But if we see areas that can be improved, it doesn't hurt to try to make an improvement and see if it makes a difference in the quality of care that people receive and their time in the hospitals.
Well, yeah, and you know what, and I know you keep mentioning in our community, this is a national topic. I mean, this is very much a hot topic when you talk about vaginal births versus C-section births, and that's a whole conversation that's also. So I'm glad that Kaleida remains on the cutting edge when it comes to topics, such as at our children's hospital, such as delivery and just the importance. And I'm glad that you're there helping, and you're part of the team. So then, do you work with all moms, or do you work or more with mothers who might be at high risk? And what does high risk mean?
So high risk can mean a couple of things. So usually it's any birthing person that's over the age of 35, has a BMI greater than 40, has any chronic illness or disease like diabetes, hypertension that maybe came about during pregnancy, or any other serious chronic disease. And the data that is discussed regionally with our affiliates, it encompasses all moms who have delivered at any of the birthing facilities. However, the data that I mostly deal with comes from the NICU at Oishei Children's Hospital.
And the NICU, for those of us listeners who aren't familiar with it?
It is a neonatal intensive care unit.
Okay, so it's a intensive care unit for babies, newborns?
Yes.
So then do you work only with high risk, or when someone is deemed to be high risk, or do you work with all moms? Does the data work with all moms?
So my data primarily focuses on the babies. So I enter information into the statewide perinatal data system, and it keeps track or keeps record of all NICU admissions across the state, and I do the data for Oishei Children's Hospital. that data then is used in in various ways. And as I mentioned before, we have meetings with our affiliate hospitals. So when they send babies to us, likely they do go to the neonatal intensive care unit, and then we can report back to them on, you know, what they were diagnosed with, how long did they stay with us, if they received follow-up from a community physician, like once they got back home, things like that.
Mm-hmm. So how long has this system been in place in New York State? And what is it called? The New York State.
The statewide perinatal data system.
And how long has it been in existence?
I am not quite sure, but I will say they've been collecting this data for at least 25 years.
Oh, okay. All right. No, that's really interesting. What do you think would happen? This is just your opinion, or opinions you've heard from others in your department or in your circles. What would they say if this data was not collected?
I believe we would have a very misunderstood outlook on what is happening in our region, specifically being unique to New York State. A lot of things that come out of the state mostly target the New York City region or maybe the Albany region. And I feel like sometimes the Buffalo, Western New York region gets left out or a little bit overlooked or just lumped in with the rest of the state. And Buffalo, just like Rochester, just like Syracuse, we have unique needs to our area. And without the information that is provided from systems like the statewide perinatal data system, we'd have a very big misunderstanding of what's happening in these areas. I feel like this data really does characterize some of the issues that are seen across our counties. For example, the issues that are seen in Cattaraugus and Chautauqua counties are not the same issues that are seen in, say, Niagara and Orleans counties. So it really does provide a very good perspective on the current landscape of our Western New York region.
Wow. That was a lot that you just said. Um, when is when do they when does the data process begin? And I'm going to take a guess. Does it like begin at the time when the mother begins delivering, or does it start before that? Like when does that chart begin to populate?
I would say it really depends on what exactly you're looking for, because depending on what you're looking for, it can start all the way back to the first prenatal visit, or it can just start on admission to labor and delivery, or it can start with um, let's say their readmission from home. Let's say there was a perfectly fine, healthy baby, but somehow they got sick and had to be admitted into the NICU sometime later after their birth. So it would really depend on what exactly you're looking for. I'll say for the system that I work in, it all starts with their NICU admission. So that's the data that I'm evaluating and entering into our system.
Mm-hmm. And I'm listening, but I'm thinking that the data is collected once the child is in the birthing process, and not thinking that they could go home and return to the hospital with complications. I'm thinking everything is within within the delivery. That covers quite a bit of things.
Yes. And I will say, since there is a lot of data, there is also a lot of really cool innovation that is coming out of the data that is collected, not just in our region, but across the state. And it allows for a unique perspective and a unique approach to solving issues that we all face. So it is a lot, but it comes at a good price. We do get beneficial information out of it.
Well, without giving away any medical secrets, what are some of the can are you able to discuss like a few things that people are doing across the state that works to improve the the health of the child, of the baby?
Sure. So, like I mentioned before, the Birth Equity Project was put in place, I believe, sometime in 2022, 2023. And it was to better understand how people were feeling in the hospital, like how represented they felt in being able to care for the baby, how involved did they feel the care team, like how did the care team make them feel? Did they feel involved? Did they feel like they didn't have much input in how they were caring for their baby? It really has shown different ways that hospitals can improve the overall approach to healthcare delivery they can provide to people. And there we just had a coaching call, I believe this Wednesday, and the way that hospitals have approached, documentation and having parent partners and having culturally competent care, or yes, culturally competent care has made a difference in people's reported experience while they were in the hospitals and have led to an increase in positive reports about that.
Mm-hmm.
So, and like I said, each hospital is unique. I believe one of the hospitals that were on the call that were sharing insights, they were in Rochester. And it
Mm-hmm.
was just really amazing to hear the engagement that they had from the parent side and the healthcare staff side to increase the reported positive experiences that they had.
And and I know you've mentioned birth equity a couple of times, and I know that a few years ago, I remember when that, and it may still be, but I remember, it was part of DEI, and I try and say in every show, at Kaleida, we still have our diversity, equity, and inclusion department that includes, several different areas. But is the birth equity, and the when you talk about cultural competency, those types of things, do you work along with the Kaleida diversity, equity, and inclusion department?
Yes, we've collaborated with them as well. They've provided insight on making sure that we're meeting the project measures,
Mhm.
and making sure that when it comes to things like signage or trying to deliver messages to our patients in the hospital, that it is culturally sensitive and is, you know, acceptable for all crowds.
Hmm. And I know that regardless of language, we are at Kaleida, all of our departments, we're able to communicate with our patients either at all of our sites across the entire system in multiple languages. So I wanted to add that. Nicole, I know our interview is winding down. So what would you like to add that we've not discussed?
I would like to share that, in our region, the RPC here, we are working to make sure that our mothers and our birthing parents and our babies are receiving high quality care, and that as we go on to further promote perinatal regionalization across Western New York, that we are able to communicate very effectively with our affiliate hospitals, making sure that they feel supported with everything and trying to be transparent with our affiliates and also with the patients that come to us so that they can understand the reasonings that they have to come here and feel supported in all aspects through their care, whether they remain in the community or they come to us in Buffalo.
Well, on that, I just want to say, I'm, my area is workforce development. Are there any, not to say are there any openings, but if somebody is interested in getting into this field, what are some of the steps that they should take if they're in school, going to school, thinking about returning to school? What are some of the steps that would prepare them to do the kinds of work that you do?
I would definitely say having an interest in maternal and child health,
Mhm.
familiarizing yourself with hospitals in your area and what kind of birthing services that they offer. That'll indicate the type of patients that they see. and to have a good grasp on the area or the landscape that these hospitals and facilities are in, and also being aware of community resources that exist to support the ongoing efforts at the hospital. Because even if there aren't positions available in the clinical setting, they are available in the community setting. So building and discovering the network that exists will really help.
Yeah, and again, something else that you just said, that it's just, again, that's why we're doing this interview. When you said to investigate what kinds of birthing services they offer. What are like the top three things you work at? A level one hospital, Oshai Children's Hospital, Kaleida. What are some of the things you would just recommend that people look out for when they're thinking about where to deliver that cute little bundle of joy?
I mean, I feel like all in any of the hospitals in Western New York, they'd be in good hands. Um, I would just consider just if you start out at any hospital that's not our hospital, just consider that if pregnancy complications arise and you do receive a referral to us, and if you have to come to us, just know that you'll be in good hands.
Yes, and that's true. Regardless of where you have your little bundle of joy, if there are any complications, hopefully they'll never will be. But if they do come out, if something does happen, that know that they're in great hands here at Oshai Children's Hospital. And on that note, Nicole, I thank you so much for being our guest. Our guest this morning has been Nicole Caver, Regional Perinatal Data Specialist, part of Oshai Children's Hospital. Nicole, thank you so much.
Thank you.
Oh, you're welcome. And listeners, I just want to say thank you for listening to the Great Lakes Health Radio program. And next week, you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center. And if you're looking for employment, job, change career, please visit our Kaleida Health website. And when you get to when you type in Kaleida Health, KALEIDAHEALTH, with that little box, click, type in careers. And I believe last time I looked, we had over 500 openings, some clinical, some non-clinical. Some of the positions you just need a high school degree or a GED, and others you need an MD degree or an RN degree. So please visit our Kaleida Health website for careers. And on that note, my name is Francesca Messiah, Manager, Workforce Development, Kaleida Health. Look forward to seeing you in 2 weeks. Bye-bye.